Dr. John Torres here with NBC News, covering some headlines that you've probably heard this last week, getting behind and a little deeper into those headlines so you have an understanding of what the actual story is, and you know, hopefully out of this, what you can use to stay healthy during this pandemic. I'm also going to answer questions, so if you have any questions, please send them our way. We'll get to as many of those as we can, but I do have to say the questions are always fantastic, and I love answering them because these are the things that you might not hear in the news, you might not hear.
It was just someone was calling. Go ahead.
So, are we still going with this? Yes. We're still going. Okay. So let me go ahead and still continue with this. Right now, the first headline I'm going to talk about is what people are calling the twindemic. And the twindemic is essentially two pandemics or two epidemics and a pandemic happening at the same time. Obviously, the pandemic coronavirus. What we think is going to happen, we think this is a cold weather virus, and it's going to come back a little more robustly in the wintertime. On top of that, that's our usual flu season as well. So the big concern is, will those two coincide? Will it cause what some people are dubbing the twindemic? The concern behind a twindemic is a couple of things. One, more people could get hurt. That's definitely part of the problem. If you get the flu, it's certainly going to bump your immune system down a little bit, make you more susceptible to other diseases like coronavirus. Getting both simultaneously is a rare occurrence. At least we think it is, but we've never been through this kind of season before. So we're hoping it is. We're hoping people don't get both at the same time. But if you do get influenza, it could get your immune system suppressed for a few weeks. Coronavirus could more likely move in, and you could suffer complications because of that. So on number two, the other thing we're concerned about too is overwhelming the healthcare system with people who have either the flu or coronavirus. You can't often tell, and going to the healthcare systems, going to the hospitals, and overwhelming the hospitals. In a given year, especially if the flu is bad, we tend to have a lot of cases that are overwhelming the hospitals. You can imagine on top of that with coronavirus, the pandemic, possibly overwhelming the hospitals by themselves. Those two together could be a recipe for a disaster, for a catastrophe. So what can you do? Well, a couple of things. One, flu vaccine. Start getting the flu vaccine. Start looking at getting it. You want it by October. Most experts say September to October is the best time to get it. Here's why. It takes 2 weeks to fully activate your immune system to fight off the flu. So you don't want to get it when the flu is already in your community. You want to have gotten it before that, so you have the biggest ability to fight it off, the biggest strength from that vaccine. Now, some people say, why bother with a vaccine? It's only 50, 60, 70% effective. And that's true. In a given year, the vaccine goes anywhere from 40 to 70% effective at fighting off the flu. But as I've talked to some experts, what they always say is, what they tell me recently is, we kind of did ourselves a disservice by talking about effectiveness at fighting the flu, because that's not what the vaccine actually does. In some cases, it can prevent you getting the flu, but in most cases what it does, it prevents you from getting complications because of the flu. So you get the vaccine, even if you get the flu, which can happen, then you're going to have less complications, you're going to have less serious illness, you're going to have less hospitalizations, and ultimately less deaths on top of that. And so that's where the beauty of that vaccine comes in. So you definitely want to get it by then. Again, September, October time frame. Everybody 6 months and above should be getting it. Some other people say, hey, I have an egg allergy, I shouldn't get the flu vaccine. Well, the CDC has come out saying you definitely want to get it even if you have an egg allergy, because unless you had an anaphylactic reaction, to the flu vaccine before, then those are the only people who should not be getting it, even if it's egg-based. However, they have developed cell-based vaccines as well. If you're concerned about it, you can get a cell-based vaccine, which was not made using eggs at all, so it should not even be a question at that point. But again, everybody 6 months and above. For some people, 65 and above, there's a double strength vaccine they should be looking at. And the vaccine typically this year, the majority of them are going to be quadrivalent. In other words, they're going to have 4 different strains. They're going to have they're going to have an A strain, two types of A strains, and 2 types of B strains. And they're going to cover what flu we think is going to hit in this area. Now again, I talked about the cold weather viruses. We know flu is a cold weather virus. We thought coronavirus was a cold weather virus, meaning that it's going to be more active in cold weather, less active in warm weather. It's not proving to be that at this point, because now during the summer we're still seeing outbreaks of cases. The concern is it's even going to be worse once the cold weather hits. And so you want to be very careful with that, and you want to make sure you're very prepared for that. One of the best ways you can do it for you and your family at this point, again, get that flu vaccine. One, it'll help prevent the overrun of the healthcare systems, but two, it'll keep your immune system as strong as possible through the whole fall and winter months when coronavirus possibly could come back and we could truly have that twindemic. Now, on the good side of things, it does look like, looking at some countries, the fact that we're doing those things we know that protect us from the pandemic, the coronavirus pandemic, wearing masks, social distancing, washing our hands, has become the norm for just about everybody. That's keeping the flu at bay as well, but there's no guarantees that'll happen. So again, getting that vaccine is very, very important. The second headline, singing. There was actually a study that just came out, has not been peer reviewed yet, but it was an observational study looking at a choir in Washington State. At the choir, the vast majority of people ended up getting coronavirus during the rehearsals they had. And here's why they think they did it, because of the singing itself. And so the CDC came out and saying, hey, loud singing in particular could really throw those aerosolized droplets out there that have coronavirus. And if other people in the vicinity aren't wearing masks, they could certainly get it as well. So that singing, you have to be a little careful with. Well, this study is looking at singing, and it looked at a couple other things. And what they did is they had participants breathe, they had participants just talk normally, and then they had them sing happy birthday. And what they found out is, yes, loud singing does throw out more aerosolized droplets, but so too does loud talking. Normal singing doesn't throw out any more aerosolized particles than normal talking. And so the lesson here is, keeping things normal. Loud talking, loud singing, those things can really throw the droplets out there, and they can linger in the air longer, possibly travel further. You have to be extra careful. So if you're at a place where people are talking loud, singing loud, you definitely want to double down on wearing that mask and social distancing. An important thing to remember. And then the 3 W's I always talk about. Wash your hands, wear a mask, watch your distance. We're doing a story about buildings and how buildings contribute when you're inside to catching coronavirus. And as I always say, outside is better than inside because that virus gets diluted, the air comes through and can move it out of the area very quickly, and so you don't have to be as concerned about it outside as you do inside, although you still need to social distance and wear masks. Well, talking to ventilation experts, they're saying, yes, that's exactly true. And they're adding a 4th W to what I talk about. So again, I talk about wear a mask, watch your distance at 6 feet, and wash your hands. The 4th W they're adding are windows. So it's wear a mask, watch your distance, wash your hands, and windows, meaning open up the windows. Get that ventilation through here and make sure that you're getting that air exchanged. Part of the problem, what they're telling me, which is true, over the last few decades, we have made buildings that are very energy efficient. In order to make them energy efficient, you end up sealing off the windows so you can't open them. That way the air conditioners or heaters don't have to work overtime. They're very well insulated. All the cracks have been sealed so that outside air, inside air doesn't exchange. Keeps them very energy efficient. The problem is because of that air has not been exchanged, so they are calling these sick buildings. In other words, buildings that were not made based on ventilation, they were made based on energy usage and energy efficiency, which is great, but during a pandemic, during some upswing in a viral infection like this coronavirus pandemic we're having right now, getting that fresh air is important. So that's why they put that 4th W, windows, opening doors, having some system set up. Even if it's a ventilation system, we can exchange that outside air for the inside air to make sure that you're getting that exchange going there so you can get that virus out of the building and get it more diluted through the air you're bringing in and out. So again, trying to do that as much as possible. And the question I asked him is, especially with our students going back to school, especially with college students going back as well, should they be doing things more outside, or should they be opening windows, opening doors? And he said exactly they should. And my question was, okay, that's fine. We're in the middle of summer. Fall's going to come, still not going to be too bad, but what about winter? He said, here's the deal. You have to remember we're in the middle of a pandemic, and so even if we have to open it up and people have to huddle up a little bit, coats, hats, then that might be something they need to do in order to keep that ventilation going through there and keep the risk of developing coronavirus as low as possible. He did acknowledge that if it's extremely cold or extremely hot, you might need to close the windows, which is why the ventilation system is extremely important. But at the same time, he said the longer you can keep them open, the much better. And there was actually a friend of mine actually sent me an article, and it was about around 1902, 1903, the tuberculosis outbreak that occurred in New York City. And this article had picture after picture of what they were doing there. And what they did is they basically put school kids either on rooftops, outdoors. They kept all the windows open. They even put them on ferries in the Hudson and would teach them there. And you see these pictures of these kids, and some of them looked like kindergartner kids. Some of them were more middle school age kids. They're all huddled down. Their teachers has a coat on, a hat on, and they're teaching. They're going through the classroom environment. That lasted a few years until they got through that tuberculosis outbreak, but lessons to be learned from the past. Hopefully that can help us here as well. So again, going over the headlines, the twindemic, the flu, and the coronavirus hitting at the same time is a big concern. Best thing you can do is get your flu shot, and then again, remember masks, social distancing, and washing your hands, and the opening up of the windows if you can. Singing. It turns out that loud singing does put more aerosolized particles in the air, but so too does loud talking. Normal singing and normal talking, about the same amount of particles go out there. So it's not the singing per se that's causing it, it's the volume of singing or talking that's causing it. So the more you can cut back on that volume, or if you're in a place where people are very loud, then you want to go ahead and make sure that you really have that mask on, you really social distance, you're doing those things. And then the fourth W we talked about, wearing a mask, watching your distance, washing your hands, and the fourth W, per all the experts I've been talking to, windows, opening windows and getting as much fresh air in as you can. And one of the hints they gave us, which I forgot to mention, if you happen to have workers in your house, you happen to have work being done at your house, or have other people over, have guests over, even though you're social distancing, you're still indoors, one of the things you want to do is open as many windows as you can, and that way you can get that ventilation through there. It cuts down on the risk you have of developing coronavirus. So now let me see if you guys have any questions. These are always great.
Can COVID-19 mock sinusitis?
Can COVID-19 mock sinusitis? When it starts, it can, because COVID-19, as I say with many of these diseases, they're all the great mimickers. And so flu, COVID-19, just about any viral infection you talk about are essentially going to start off the same way. They're going to start off with fevers, body aches, chills, probably a cough. You can get congestion, and that congestion can mimic a sinus infection. The big difference is, with coronavirus, you don't tend to have that nasal congestion that you do with a sinus infection. And so that's going to be a big differentiating factor. If you do have that nasal congestion and it doesn't seem to want to go away and it seems to be getting worse, we'll start thinking more, okay, this might be more a sinus infection or just an upper respiratory infection, which is more than likely to happen, especially as we start getting into our winter and fall months. With coronavirus, the thing we're finding out is there are, by last count, around 100 different symptoms. That some of these can be very unique symptoms, but for the most part, people tend to start off with fevers, cough, body aches, the loss of sense of smell and taste that they get, and then abdominal pain is the next most likely one, with diarrhea or vomiting. So it doesn't tend to be an upper respiratory type infection like a sinus infection would be. But at the same time, they could both start off similarly. They just diverge at one point, and coronavirus again turns more into respiratory, upper respiratory infections. Sinus infections turn more into the congestion that you're familiar with.
Should we get a pneumonia shot right now?
So the question is, should you get a pneumonia shot right now? And it's recommended for adults as we get older, and definitely want to get the pneumonia shot before the cold season hits, the flu and the virus and this twindemic we're talking about, because it can protect you from some of the pneumonias that are out there. This is not a shot for everybody, but for elderly Americans, as we get up 65 and above, you want to think about getting your pneumonia shot. So definitely a great idea. Unless you're sick right now, wait until you're past your illness and then get the pneumonia shot. Like any other shot, it takes a couple weeks to kick in, but it should protect you from that, especially going into this respiratory viral season that we're going to go into. Flu, RSV, coronavirus, all the things we typically have in the wintertime.
My son is getting married out of state, quite a bit away. It's an outdoor wedding. I'm 72 years old. What do you recommend? Should I go?
So the question is, my son is getting married. He's going to go. It's out of state. It's quite a bit away, but I'm 72 years old. Should I go? Well, 72 certainly puts you in that category of people we get more concerned with, because you have a higher risk of complications from coronavirus. And the older you are, the higher those risks are. Typically starts around age 65. 80 seems to be a big bump in complications as well. But 72 is in that group where we get concerned about you. So if you can do it virtually, that's the best advice. But understand, I know the realism of doing that. It's not the same thing. It's not quite the same as being there. If you can go to it, and there's a way you can separate yourself from everybody else, but still at the same time see the wedding and participate in it, something you might want to do. If on the other hand, it's a wedding where you go and everybody's going to be there, nobody's going to be wearing masks, you have no idea where the other guests are from, and they possibly could be spreaders of coronavirus, you want to be careful with that. And so although it's probably going to break your heart not to go to the wedding, it's one of the things you want to think very carefully about whether you go, what your risks are of going there, and the complications that could result from that. So at 72, my recommendation would be to look at it very hard, to think about going there, because even though it's a special event and a special time to be there, being there for them over the next few years is something they're going to really want to make sure that you are able to do that versus just being at the wedding.
Can you get a few shots or vaccinations at the same time during this time?
Can you get a few shots or vaccinations at the same time? And I think they're probably referring to children, because children tend to get multiple vaccinations at the same time. And yes, you can. And there's limits to how many you can get. And we have schedules on which shots we can give at the same time. But yeah, there's nothing to preclude you. There's nothing to preclude you getting the normal vaccines that you usually get because of the coronavirus pandemic, as long as you're not actively sick at the time. But one thing to do remember is the American Academy of Pediatrics has come out with a statement saying, hey, children need to get caught up in their vaccinations. There's been a big drop-off over the last few months because of the pandemic. The concern is with children going back to school, especially with the winter months approaching, we know these viruses tend to circulate more. Measles, mumps, the different ones that we have vaccines against. So you want to make sure your children are vaccinated, they're up to date on their vaccines. People going back to college, students going to school, especially if it's their first year, meningococcal vaccine is important. So look into getting that as well. And these are just the regular things that keep them healthy. If you can stay healthy, you have the best chance of fighting off coronavirus.
I heard that a 3-year-old has the same dosage for a flu shot as an 18-year-old. Is this true?
So the flu shot, there is no pediatric flu shot. The flu shots are basically essentially the same, and up until you get to age 65, and then there's a higher dosing flu shot for adults, because once you get to 65 and above, your immune system starts to weaken a bit, and you don't get the reaction we want from the flu shot, meaning your immune system doesn't get boosted nearly as much as it should. But for children, not a big issue getting them the flu shot at all. So the dosing is appropriate for all ages.
What's the difference between the common cold and COVID-19? Isn't the cold also a coronavirus? So
the question is, what's the difference between a common cold and COVID-19? Isn't a common cold coronavirus? It can be. Colds come about because of a couple different viruses. Coronavirus, rhinovirus tends to be the one that mostly causes cold. But what we do know is that up until now, there have been 6 types of coronavirus that affected humans. 4 of them caused a common cold. The 5th one was SARS back in 2002, 2003. The 6th one was MERS, Middle Eastern Respiratory Syndrome. And then the 7th one came along, and that's the coronavirus we have right now. And so, true, some of these do cause the common cold. Some of these cause other types of issues that we had concerns in the past, SARS and MERS. And then the 7th one, the newest one that has adapted to humans, is the coronavirus, the SARS-CoV-2 we have right now. Now, even though they're in the same family, essentially think of them like cousins. So they're all cousins of each other, so they're not going to be quite the same. They're not going to quite be doing the same thing to your body, and they're going to affect you differently. The SARS-CoV-2, which is the coronavirus we have right now, is obviously the big concern because of the pandemic and how it's affecting millions and millions of people around the world.
Can your clothes carry the virus if you were around someone with COVID-19?
Yes, your clothes can carry the virus if you've been around somebody with COVID-19, but it's not that big of an issue. Now, in the hospital setting, especially in the emergency room or ICUs, where you tend to be around a lot of people that are sick with a lot of different viruses, including coronavirus, you do get concerned about the viral load that could be on your clothes. And so typically what a lot of us will do is when we get home is we usually go to the bathroom, we disrobe, put it in a bag, go ahead and take a shower, throw all that in the wash, and then put new clothes on, and then we greet our families just to make sure, because for a short time period, as in a few hours, it could live in your clothes. It's not likely to, and coronavirus doesn't thrive very well in clothes. And so if you've been out and about just in a normal environment, you've been doing social distancing, not a huge concern. If on the other hand you've been in a crowd setting or you've been in a setting where you've taken care of people with coronavirus, then you want to be careful with your clothes. Same with your shoes. And that's why I recommend a lot of people come in, basically take your shoes off at the door, have some slippers or other shoes you can walk around the house with, just so you're not dragging it around. But it doesn't last that well in those environments. It is definitely a respiratory virus, and so it lasts longer with people coughing and sneezing and getting in the air. Your chances of getting it are much bigger. And then as far as on regular surfaces, again, that's not the main mode of getting the virus, of transmission of the virus. The main mode is the respiratory one.
Shouldn't the masks we're wearing now protect us from the flu as well?
So the question is, shouldn't the masks protect us from the flu as well? And actually what's protecting from the flu at this point, at least in different parts of the world, are masks, social distancing, and washing your hands. And what they found In Australia, which typically has a very bad flu season during their winter, which is our summer, they didn't have nearly as bad a one this year. But we cannot rest on our laurels because we don't know if the same thing is going to happen here. Number one, their mask wearing tends to be better than our mask wearing, and our social distancing tends to be better than our social distancing. And here we're obviously having issues with having these outbreaks occur because people aren't necessarily wearing masks or social distancing or restricting the group size like they should be. And so that could continue through the winter, which means we could have outbreaks of the flu that we're not seeing in other countries. So even though it looks like doing those things we know protect us from coronavirus could also help protect us from the flu, we're not sure that human behavior will make sure that people are doing those things and can protect us from the flu. So getting that vaccine is just one more protection measure to make sure that we make it through the season as safely and as healthy as possible.
Is being overweight a risk factor for COVID-19?
So is being overweight a risk factor for COVID-19? Yes, obesity is a risk factor for COVID-19. It tends to be one of the bigger risk factors. And so obviously, it's not the type of thing where over the next few months you could lose a drastic amount of weight, but at the same time, getting weight under control could be an important thing. Plus, making sure if you do have a risk factor, whether it's obesity, whether it's high blood pressure, kidney disease, respiratory illnesses, being 65 or above, you want to take extra care of yourself. And when that vaccine does come out, you might be in that first group that's able to get the vaccine. Think long and hard about getting that vaccine to protect yourself from getting coronavirus and more importantly, protect yourself from complications of coronavirus. The vaccine, when it does come out, more than likely it's not going to be a vaccine that's made to purely prevent coronavirus. Just like the flu shot we're talking about now, it doesn't purely prevent you from getting the flu, but it does prevent you, hopefully, from getting complications. It helps you from getting hospitalized, helps you from dying. We think the coronavirus vaccine, at least the first ones that come out over the next couple of years, are going to do the same thing. Might not prevent you from getting coronavirus, but should help in preventing complications, should help in preventing hospitalizations, and should help in preventing you from dying from coronavirus. So hopefully, as we get more information on the virus, we have a better understanding, and we have an understanding of how they're going to distribute it. But if it's high-risk groups, you're in a high-risk group, you should think about getting it initially through that first salvo of people that are going to be getting it. But thank you again. Questions fantastic. Headlines, we talked about the twindemic, the flu and coronavirus together, the confluence of those two viruses that could cause issues with our healthcare system, but also could cause issues with making you more susceptible to one or the other. The one thing you can do, there is no coronavirus vaccine, but you can get your flu vaccine. September, October is the best time to get that. Singing, it turns out that singing does not push any more aerosolized particles out in the airstream or in the environment than talking does at the same volume. So if you sing loudly, you're going to push more virus out there than if you talk softly. But if you sing loudly and talk loudly, it's about the same thing. If you talk normally and sing at a normal volume, about the same as well. So regardless, somebody singing, somebody talking, even people breathing, you want to make sure you have you have your mask on and your social distancing. And then the fourth W. I often talk about the 3 W's. Wear your mask, watch your distance, wash your hands. Talking to all the ventilation experts and public health officials, they're saying, yeah, add that fourth one, windows. Open windows whenever you can to get that fresh air circulating. But as always, thank you very much for listening. I hope you have a fantastic weekend. And as always, I hope you, your family, your loved ones, and your community stay as happy and as healthy as possible.